All right, everybody, welcome to lesson 3. Now, congratulations on getting through lessons 1 and 2. Those are your real core items in beginning to improve your note speed. And don't worry, if you have to go to shift right now or you have an upcoming shift, you should be equipped with enough that you can get going and improving your note speed. This lesson will additionally create some of the reaffirms some of the themes that we have been talking about in terms of standardization, creating a system, but it's more to show you how to put everything together. So here, again, the focus we want to think of is how do we create a system? Because this will offload cognitive burden and allow you to create a note even through distractions. And that's the goal here, because obviously we know we are facing many distractions in our ER shifts. So here's what we'll cover: systemizing your HPI, systemizing your ROS, your physical exam, and your MDM. So let's start with systemizing your history of present illness. As you've seen in some of these examples that I've been doing, I've put in a .hpi dot phrase, and it creates a standardized HPI template with greater than 4 modifiers, which is what is required for your billing department. And so this is a dot phrase. It's pre-filled with modifier headers to streamline your flow, and filling this out takes somewhere around 30 seconds. We can quickly go through one right now just to take a look. So here we are in this note, and I do want to emphasize how important it is to standardize your HPI. This should be so routine to you that you are not writing new HPIs. A lot of people write HPIs, something like 55, male presents with chest pain, it is radiating, it is pleuritic, and I want you to see just what's wrong with this. Reports, he had catheterization, which if you are typing this often, it should also have macros and dot phrases to make, so you should not be typing that words out. But it's sort of unorganized, and it just doesn't follow a train of thought or a pattern of thought. Now, what we'd rather do is, even if we were writing this from scratch, which we do not have to write from scratch, we want to focus on systemization. So we want to know it's 55-year-old male presenting, and I'm purposely not using any dot phrases here. He's presenting with chest, because I want to focus on the systemization. He's presenting with chest pain. The duration is 5 hours. The course is constant. The onset is sudden. The character is dull. So I have this memorized. I know exactly what's coming after the next. I know it goes duration. I know that after that I'm writing course, and then I'm writing the onset and the character. And then after that, I'm going to put no exacerbating or alleviating factors. Of course, I have macros that can fill that out for me in dot phrases. But my point here is the systemization of your HPI. Whether you are typing your HPI or you are verbalizing your HPI, it should follow a system. Place your modifiers up front, and then you can put a little story out here. You know, just saw cardiologist yesterday, okay? But these, the point of this is systemization, and I want that to be the focus. So that way, even if distractions happen, you can quickly look at your template and pick up where you left off. Your template is memorized and you know where it is. Now, this is what I was mentioning earlier that will help you avoid writer's block, because when you have a systemized HPI, when you have a systemized MDM, you will be able to easily get through it, even with some minor distractions, okay? So this is just some generic stuff. If the history is not obtainable, you could use a dot limit, a dot phrase at the top of the HPI. That will help you not have to fill out every single modifier. And I can show you a quick example of that. But in fact, you will see that in my dot phrases. So say we are here. And let's just say we just didn't know many of the things here because this guy was not very good historian. So what I would do here is I would go to the top right here, and I would put dot limit. And these are limits that I have for patients. And he's a poor historian, or maybe had poor hearing. So we would just put that in here, and that'll give you a leeway on the billing for a level 5 chart. All right. We'll continue on here to having a systemized review of systems. So have this review of systems in your pre-completed note, or utilize a macro, or utilize a dot phrase to pre-populate it. But of course, you should not be retyping a review of systems, and your review of systems should be concise, and you should be editing minor things in it that are positive. Memorize it. You only need to change 1 or 2 pertinent findings on it, and this should take less than 10 seconds. What I mean by that is, we will go through an example, but remember, your review of systems is a rule-out system, not a relist everything system. So for example, if your patient has chest pain, and they do not have any nausea or vomiting or fevers, and that's included in your review of systems, that's great. And if they have chest pain, but they're also saying that they might feel weak or are feeling dizzy, and those things are not a part of your general ROS, you do not need to go into your ROS and put positive dizzy and positive weak. Those are already mentioned in the HPI, and you don't need to go in and continue to add these and continue to type and put extra time and extra keystrokes into your note. So we'll do an example of that here. Again, this is the same note we've had open. Say we've completed our .hpi here. And we will go to our review of systems and easily just put in a .ros comprehensive. Now again, you see how we have our macros here, or our dot phrases, and we can easily pick one or the other. I will go with comprehensive on this. I know what's in it. And we can say that this patient maybe had some chest pain, and, you know, addition to all of that, they additionally had some weakness. So again, here we have no fevers, no chills, no sweats. I would not come in here and put positive weakness. This is a time-consuming process, and again, these are extra keystrokes that you do not have to do. And all I would change here is this to a positive chest pain. I would not include this. Again, we are not trying to relist everything. This is not our place to relist everything. Many people will relist it here in the HPI. We'll put it in the HPI. We'll relist it in the review of systems. And then as they write their MDM, we'll relist everything that they've relisted in their HPI and their ROS. This is excessive, and again, the redundancy creates opportunity for error and does not speed you up and does not add to your chart. So just something to be aware of. All right, we'll continue from here, and we will go into your systemized physical exam. Again, much like the review of systems, have this included in a pre-completed note, or use a dot phrase or macro to pre-populate it. Again, memorize it and only change 1 to 2 pertinent findings on it. You can create my physical exam macros. I've included them for headaches, traumas, cardiac arrests, and normal and pediatrics. So this should be relatively quickly. Again, remember, as we have discussed, your physical exam comprises a big portion of your legal defense, and you want to be attentive to your physical exam. And having systemized pre-completed physical exams for many of the situations, I'll take you through an example real quick of a trauma physical exam. We know these can be extensive, and there's many body parts to check. So here we are back in the note, and we are looking at our physical exam here, and we have a patient here who has undergone a trauma. So we can look at our few physical exam categories that generally cover many of the things that we are looking for. So we are looking for a physical exam trauma. We can go here. We easily have our whole physical exam trauma. We know that the neck looks okay. This is maybe for a minor MVC where we've done all our checks and we don't see anything abnormal. It's supple, it's non-tender, the neck is rotating well. Now, say we wanted to add in an additional neck exam for the muscles of the neck. Well, there's .PE neck muscles, right? So we're able to move the neck against resistance with 5 out of 5 strength in all these directions. And these are the things we want to focus on. Quick dot phrases that can add into our physical exam. Let's say here that the GI, we had soft, non-tender, it's non-distended, and they additionally had, I want to make sure that to deep palpation that we know that there's nothing. So I would type in .abd deep, and it would pull up that it's non-tender to deep palpation. Really shows that I've done my physical exam here. Again, my musculoskeletal is filled out, my back is relatively filled out, and here, let's say we wanted to do a more detailed and thorough neurologic exam. Well, we would just add into this a .neuro. We have a .neuro altered. Maybe we didn't do a full neuro exam, but we know that everything's symmetric. There's no nystagmus, and they're moving all their extremities. We want to portray that. So we're able to quickly do that here with a dot phrase, and this took us almost no time at all. And we've got a very thorough note here and a very thorough legal defense in terms of our physical exam. All right, we'll move on from here. And one of the most important things to save us speed is systemizing our MDM. Now, we will go through an example of this, but let's go through some themes right before we go through that example. MDMs are to be completed at patient disposition. Jumping in and out to continue updating is time consuming. Please be aware of this. Every time you jump into and out of a chart, extra clicks, these are all taking your time. Summaries, these are summaries. We're not writing essays. We're not writing a memoir of the patient or a biography of the patient. This is a summary. It includes what our care comprised, that we matched or exceeded standard of care, and that we addressed the patient's concern. And it should, most of the time, this should include objective findings as much as possible, rather than theoretical findings or anything that can be dismissed or questioned based off anyone's own intelligence. Again, we want to have a systemized approach. We want to tell a story comprised of objective findings. We have a top line for example, mine is organized as following. I have a top line that has vital signs and presentation. I have a next line that has physical exam findings. Next line is lab findings. Next line is treatment provided, and then there's a disposition. And then there's even dot phrases that comprise all this if everything is negative. And we're going to jump into a quick example. All right, so here we are at the MDM, and I want to assume that this patient had some chest pain. Well, let's go through it. The patient came in and he had a little bit of elevated blood pressure. I have a macro that will include that. So my first part of my MDM is always this is a summary. So my first part is a recap of how the patient presented. So maybe he presented with some elevated blood pressure, however, the rest of his vitals were stable. But I also want to indicate that he was well and he was non-toxic appearing and he was afebrile. And that's how he appeared to me. So initially, how did he present? How did he clinically look to me, right? And that's my second line. The next one is, I might just say, presents with chest pain. Following that, I might say, the labs, well, I might say he was given aspirin. So given aspirin and nitro. The next thing is I might say the EKG looked okay. So I have a dot uppercase EKG, and that just shows his EKG was normal. I want to report that his labs were normal. I want to report that his troponin was normal. I want to report that his symptoms improved throughout his stay. And then I would like to report that he was discharged. And so, and I could even report that he was discharged with cardiology follow-up. So there is a dot phrase for that. So here we have a summary of everything We know that this patient had came in with chest pain. He was given aspirin and nitro. His symptoms improved, and he was discharged. Now, this isn't a comment on clinical care. I'm just giving an example here. Now, if you have this case happen enough time, I'm just, again, commenting on systemization. You want to have some kind of structure to your MDM, and that can be your own structure. It could be however you like, but there needs to be some sort of structure and some sort of pattern that is always followed so that you know you are putting in the patient had normal labs, the patient had normal imaging. So right here, for example, after our EKG, we could have included that the patient's chest x-ray was normal, right? Again, systemization is critical, and once you systemize, you will begin to understand your notes a lot better, and you'll be able to work through distractions. Now, for example, what if this patient, I wanted to say that he came in with an elevated blood pressure, everything else was stable, that we got 2 troponins and 2 EKGs, and he was good to go after that. Well, you can actually include your own dot phrases. So here is a dot phrase that would include all that everything, a troponin times 2, an EKG times 2, and nothing was suggestive of any acute process. And then I can also still, again, discharge him with cardiology. Now look how quick we've comprised that note. This just takes a matter of seconds. The more time we're shaving off patients like this, we are able to quickly gather our thoughts, gather ideas, offload our cognitive burden, and save our complex notes for those who are truly critical. So overall, I hope that video quickly shows how we can systemize our MDM to using our dot phrases, using everything we have learned to quickly create a story of objective findings. Again, we want to refrain from things that would prolong our note, pontificating, things that are not extremely objective, and just our general feelings. And of course, there's room for that, and I'm not generalizing, but the more objective we can keep it, the more summarized we can keep it, the better, and the better for us, the patient, and our speed as well, and our flow. So here's what we've covered in Module 3. We've covered systemizing our HPI, including our modifiers up front and having a system and organization that we always know. It is much more difficult for our brains to not systemize processes. And it's much more difficult for our brains, for example, on an HPI to say, I don't believe, the patient comes in with chest pain, it was non-radiating, he saw a cardiologist, it didn't work out well for him, and now he's here. Oh, and the pain also is pleuritic, and it's worse when he moves, but it's better sometimes. It lacks organization, and the jumping of all these thoughts cause somebody not to be able to focus, and if there's any one minor distraction, that flow is gone, and you will not be able to remember where you are. That's why having that systemization is important, and feel free to go back and watch how we systemize that the history of present illness. The systemized review of systems and physical exam, these are dot phrases. They are ready for you to go, especially the physical exams. Very key, because anytime you have things that are systemized, that is something you can do through distractions. Your mind has now automated that process, and you are able to move through it quicker. And same with our MDM. Every time you have something with dot phrases and systemization together, you are now going to move through that note much quicker. You can even do it as people distract you, and it won't offset you. It won't throw you off. So here are your action items for Module 3. Standardize your notes. This will create mental clarity and increase your speed. Whatever it is that you want to standardize it to, just make sure to create some standardization and consistency among your notes so that not each note is different. Remember, systems create efficiency. So here's a quote by Francine J. My goal is no longer to get more done, but rather to have less to do. So here we could see this is something that we can use as an analogy for many different things in life. Systemization is how complex things become accomplished through an easy method. And that's because there's a system that does the same thing. It knows what it's doing, and it does it over again. And this is how cars are built. This is how homes are built. Everything, it's based off a system. For example, they do not say, hey, we're going to start building the door, and then we're going to attach the trunk of the car, and then we're going to attach the hood. There's a system. There's a frame. Maybe then the windshield goes on, maybe a door goes on, but there's always the same order. It always happens the same, and that takes off cognitive burden. Hopefully that was helpful, and we'll continue to the next module.